Hey, you know what? It's that time of year. A lot of athletes are out and about. They're getting their game on, maybe. And when it comes to summertime and those athletes, they go through their own sort of skin issues. And there's sort of 5 dermatologic issues that they're dealing with. And with us today is Dr. Brett Shulman, a dermatologist with Rochester Regional Health, to talk about those common athletic issues when it comes to the skin. And how you can help them, how those athletes can get some relief.
Absolutely. Now, I think that the one thing that we always want to think about is the most common sports-related injury this time of year, and that's the sun.
Yeah.
And it's so important that people use sunscreen, and it's really important because we spend a lot of time in the water to remember that sunscreen needs to be reapplied every 45 to 90 minutes when you're in the water. But above and beyond that, you also can get into a variety of other conditions, and there are a lot of infections that people can get into. So the traditional things like jock itch, athlete's foot, certainly if you have contact sports this time of year, and certainly soccer, those sorts of things will produce this. Remember that if somebody has an infection on their skin and touches somebody else's skin, that there's a good opportunity for that to be passed from person to person.
Is there a way to prevent that type of stuff?
Certainly, first of all, the most obvious way is to make sure that the person who has the problem is treated. So that if you notice something on your skin that doesn't look right, you want to come to a dermatologist or whatever your primary care provider is to make certain that that's being treated. It's not just your problem, but if you're in contact with somebody else, it can become somebody else's problem.
But you're talking, it's the heat, the humidity, right? You've got, maybe you're wearing gear that's rubbing up against the skin. You're getting blisters, acne. I mean, it can be a whole host of issues that crop up, right?
The other thing after infections is our physical factors. And so we wear a lot of very tight gear. Bikers, for example, wear very tight clothing. And that rubs on hair follicles and ultimately can lead to blistering, can lead to inflammation of the hair follicles, which can be very itchy, can be very annoying, and really have very easy fixes. So they're the sort of thing that if you have them, call, because they're really very easy things to fix.
As far as when you have athlete's foot or jock itch, is a lot of it just keeping those areas dry?
Absolutely. I mean, friction is a big problem, and so when you add moisture to that, so sweat, what you're doing is you're increasing that coefficient of friction, and when you do that, all these problems just magnify themselves.
I'm sure there are a prescription or fixes, but what about anything over the counter that might help?
Absolutely. I mean, what you're looking for is to try to reduce sweat in a lot of cases. So there's a really wonderful product called Z-Zorb, for example, which will wick away thousands of times its individual weight in terms of sweat. Reduces friction a great deal.
Sunscreen, clothing.
Sunscreen. Clothing is also good, and a lot of the clothing today is being manufactured to try to reduce these problems. A lot of the higher-end clothing these days is really trying to address a lot of these sports-related injuries as we become a more sports-oriented society.
How interesting. And acne, too. That's something that when we were looking down the list, I didn't think about.
Well, acne clearly is a big problem. So some of this is frictional. Some of it is actually from sweating. And some of it is the fact that we use products that have a tendency to plug our hair follicles and produce acne. So when you put all those things together, you can really see an increase in acne this time of year. You can also see flares in conditions like psoriasis and eczema. And again, these are all things that have very easy fixes.
So if you've got one of these issues, or any or all of these, you need to see a doctor. And again, some of these fixes some are over the counter, some are actual, you need prescriptions to keep your skin as healthy as possible. So don't hesitate then, right? Because these can get worse over time.
Absolutely.
And Dr. Shulman, if you could recommend one sunscreen or one sunblock for athletes, what would you recommend?
You know, I think what you really want is a product that has good longevity.
Yeah.
So I think the gels really do a very nice job. There are some really wonderful new products that are available that you can actually put on in the shower, which are a combination body wash and sunscreen. And I like those because they're just easy to use. But the most important thing about sunscreen is to remember that you need to reapply sunscreen every 2 to 4 hours.
Great. Thank you so much. We'll be right back.
Always so good to talk to you, Doctor.
Thank you.